The wrist is formed where the long bones of the forearm, the radius and ulna, meet the small carpal bones. One of these carpal bones is called the lunate. Like other body tissues, bones must have access to the nutrients carried in blood to remain healthy. If this blood supply is compromised, the bone will begin to die, a condition known as avascular necrosis. Avascular necrosis that occurs in the lunate is known more specifically as Keinbock's disease. Blood is usually supplied to the lunate from both the dorsal side, or the back side of the hand, and the palmar side. Blood vessels are incorporated into ligaments that attach the lunate to the radius, ulna, and other carpals. Different factors may contribute to the development of Keinbock's disease. One factor is that some people only have a single blood vessel supplying blood to the lunate. There is also an association between Keinbock's disease and a negative ulnar variance, or ulna minus. This is when the ulna is shorter than the radius, which changes the mechanics in the wrist and may place more stress on the lunate. However, negative ulnar variance is common, while Keinbock's disease is not. Keinbock's disease is also associated with wrist injuries and ligament instability. The blood vessels may be pulled away from the lunate when the wrist is sprained. Keinbock's disease progresses through 4 stages. During stage 1, the lunate may appear normal on x-rays, or there may be a subtle fracture. The wrist begins to hurt, and symptoms are similar to those of a sprain. During stage 2, the lunate becomes sclerotic, or hardens. Because the bone is now more dense, it appears as a brighter white on x-rays. During stage 3, the lunate begins to collapse. Pain, swelling, and stiffness worsen. Grip strength weakens. As the lunate collapses, surrounding carpal bones begin to shift around it. The mechanics of the wrist change, causing excessive wear and tear on the carpals and leading to stage 4, in which the entire wrist becomes arthritic.